Let's talk about what a hemoglobin A1C even means. Bringing it down to 6.3 is amazing. Hello everyone, and thank you for your time. This is SAC Health Answers, our video series where we answer questions about your health. Whether you're a patient here at SAC Health or just looking for reliable medical advice, this is the program for you. I'm Dr. Jason Lohr, the CEO here at SAC Health and also a family doctor in our community. Today we're tackling a question about managing type 2 diabetes through lifestyle changes. If you were diagnosed with type 2 diabetes and your hemoglobin A1C was 7, but you brought it down to 6.3 through diet and exercise, are you still considered diabetic? And do you still need to take medications? Well, that's a great question. And first, I want to say congratulations. If you've been able to decrease your hemoglobin A1C from 7 to 6.3, that is huge and job well done. Let's talk about what a hemoglobin A1C even means. Hemoglobin A1C is actually the amount of sugar that has been coated on the red blood cells, and it gives an average of your sugar over the last 3 months or 90 days. So it's much better than a single sugar test, which would just tell us how high your sugar is at the moment. We're able to look back 3 months. Our goal for A1C is actually 7 or less. So even at that original 7, that's a pretty good number. But bringing it down to 6.3 is amazing and great, especially since you did it without medication. And we love to see that. Remember, you still have a diagnosis of diabetes, even though you've actually brought it down from 7 down to 6.3. But we do call that, when it goes below 6.5, we actually call that really like remission. The diabetes has actually gone into remission, which is wonderful, but the diagnosis still remains, and you still have to maintain the same things that you've been doing with diet and exercise in order to maintain that sugar at the level that it's been. As far as medication, you don't need medication if you're able to keep that level under a 7. And so that's wonderful. In fact, if you can manage it with diet and exercise, that's just as good as using medication. In fact, we have some patients who are actually beyond medication. They use diet and exercise. They get so well controlled, we can actually decrease the medicine and in some cases even stop the medicine. And that is great and a great reward for patients, knowing that they're doing such a good job on their own that we can actually reduce or even stop their medication. But remember, don't do any of that on your own. You always want to talk to your primary care doctor about any adjustments you would make in your medication. Thank you for your question and thanks for your time. We hope you'll stop by for our next episode of SAC Health Answers. See you then.